My name is Rachel Young, and this is my teaching learning plan. I'm here with my learner today, Hannah, and today we are going to be learning about postpartum depression and the signs and symptoms, both behavioral signs, emotional signs, and when to reach out to your healthcare provider if they don't disappear about 4 weeks post-birth. So, starting off with behavioral signs of things that others might notice as well as yourself: excessive crying, loss of appetite, or on the flip side, you could be experiencing emotional overeating. You could have difficulty bonding with the baby. This includes not wanting to breastfeed, not feeling inclined to come to the baby to comfort it when it's crying or to assess what it needs at the moment, avoiding the baby even. Another sign behaviorally would be withdrawing from friends and family, kind of neglecting the role within your family dynamic, whether not just with the baby, but your partner as well, or other family members, just withdrawing contact. Insomnia, poor sleep, not being able to sleep, feeling fatigued often is another behavioral sign that you may be experiencing postpartum depression. Another thing to look at would be the emotional signs, and these can include feeling anxious, restlessness, which earlier we mentioned insomnia, which can look like excessive energy. Like you might be feeling very rested when you should be going to sleep, and then very sleepy and fatigued when you should be rising. Depression, of course, irritability with the baby or your partner or friends and family. And some of this is normal in this postpartum period. They call it baby blues sometimes, and it is caused by the hormonal fluctuation that a woman is going through post-birth. Her hormones are evening out during this period, and it can cause these symptoms to occur. But it's very important to know when to contact the provider, and this would be if the symptoms that we described a few moments ago are getting worse or lasting longer than 4 weeks. Depression is making it hard for you to bond with the baby. Again, not wanting to breastfeed, engage the baby, even avoiding the baby. Depression is making it harder for you to complete everyday tasks. You're neglecting your own hygiene or self-care, the baby's self-care, hygiene. Just tasks overall feeling insurmountable almost, when previous to this it was normal and everyday things that you could work through. And probably one of the most important would be if you're having thoughts of harming yourself or the baby. And there are effects on the baby as well in regards to postpartum depression, and in the long term this can lead to general cognitive impairment, impairments with the child's intelligence as they age. It can affect their language development as well, and there is a higher association of anxiety and depression seen in children of depressed mothers, postpartum and depression coinciding. And hyperactivity and impulsivity in the child as well, developmentally. Here is some information regarding community support, and the first one, Postpartum Support International. There's a website for online group support. It's video calls and things like that you can have to help feel heard and validated, and cope together with other women who understand what you're going through. And then the second one, Talking Postpartum Depression, there is a 24-hour call number right here for if you're in the moment feeling overwhelmed and need someone to talk to about how you're feeling, they also help you get in touch locally with doctors who specialize, or therapists who specialize in postpartum depression, which coping mechanisms that you can engage into are music therapy, cognitive behavioral therapy, dialectical behavioral therapy as well, if therapy is a route that you want to go. And there are options once you get in contact with your healthcare provider to get on antidepressant or anti-anxiety medications if therapy isn't the route that you feel like you want to go. A consideration with that would be if you do plan to breastfeed, because some medications can be transferred through breast milk, so you might have to decide to use formula instead. But again, here are some resources in the community that you'll be able to utilize, and thank you so much for your time.
Thank you.